This is nasal prongs, which can be used to give low flow oxygen to the patient. Up to 5 liters per minute oxygen we can supply via these nasal prongs. Above 5 liters per minute, airflow is uncomfortable to the patient. So this is good for low flow.
This is called a Hudson mask. So need not be applied close fitting. Depending on the flow rate you apply, patient gets a FiO2 ranging from 24% to about 40%. This is a Venturi face mask. These are called Venturi devices. This color coding is not universal. In fact, if you look at here, the flow rate and the delivered FiO2 is mentioned in the Venturi device. You have to connect the Venturi device to the face mask like this, and once you deliver this flow rate, now for example, this Venturi piece says it delivers 24% once 4 liters per minute flow is given. So if you give 4 liters of flow rate to this face mask, the 24% oxygen is delivered. In fact, this face mask need not be tight fit into the patient. So it's more comfortable for the patient. This is an non-rebreathing mask. This consists of 3 parts: reservoir bag, face mask and valves. When the patient breathes out, exhaled air is vented through these 2 one-way valves to the outside. When he breathes out, the oxygen delivered gets collected in the reservoir bag. With the next breath, oxygen collected in the reservoir bag is inhaled by the patient. By this way, we can provide up to 60% oxygen with a flow rate of about 10 liters per minute and up to 70 to 80% oxygen with a flow rate of about 15 liters per minute. In fact, patient should, there has to be a face mask should be close fitting so that when the patient takes a breath, the bag should collapse.
Demonstration of CPAP BiPAP machine. In our hospital, we use ResMed Stella 100 CPAP machine. Before using this equipment, we need to know about the parts of the equipment. There are 2 main parts of the equipment: main unit and humidifier. The humidifier can be separated from the main unit by pressing a switch under the surface. Humidifier. This is a plastic part containing a container for store water. This lid can be opened and the water container can get out. We need to add sterile water to the container up to the level shown here. Once you fill up the container, place it back and close the lid. Then we can connect the humidifier to the main unit by pressing in. Of course, we do not need to remove the humidifier to fill up the water container. Tubing. This equipment has a single tube. Both ends of this tube are the same. One end connect to the port in the humidifier and the other end connect to the patient interface, which is the face mask. CPAP mask, patient interface. This looks like a normal face mask, but this has special features too. This surface is helping to achieve a good seal to the face of the patient. This piece connects the tube from the CPAP machine. There are several loops to connect the mask to the patient's face using harness, which we demonstrate soon. The mask should be placed over the patient's mouth and nose, and this part should be directed to the head end of the patient. Once the mask is fitted to the patient's face, there should be no or very minimal leak. CPAP harness. This is the CPAP harness. This is used to fix the mask to the patient. The main part of the harness is placed behind the head of the patient, and then the mask is fitted using the straps of the harness as shown here. If there is an air leak, it should be corrected by adjusting the straps. Main unit. The main unit is powered by an AC current or an inbuilt battery. However, it is advisable to connect to the main current using supplied current cable. The rear surface of the main unit. The rear surface of the main unit contains several connection ports and a switch. 1. Oxygen connection port. This is an easily damageable piece and should be handled with care. It is better not to detach from the main unit. The oxygen source should be connected to this port by a tube. Second one, USB port. Third, pulse oximeter connection port. Fourth one, main on and off switch. This is a small switch here is used to on and off the unit. This switch does not have an on and off position. It appears the same in both positions. Once you press the switch, it will change on to off or off to on. How to start the therapy? 1. Connect the humidifier. Connect the tubes. Connect the oxygen source. Four, plug the unit. The green bulb on the upper surface will indicate the power supply to the unit. 5. Press the switch on the rear surface once. Then the main screen will be lighting up. The machine takes few seconds to ready for function. Once the machine is on, you will see the treatment screen. Lock and unlock the main unit. Once the machine is on, you will see a locked padlock sign in the right upper corner of the main screen. You are not allowed to change settings unless you unlock the unit. To unlock the unit, press the right middle buttons which have two tick signs and middle knob together for few seconds. Then the unit will unlock and the locked padlock sign will change to an unlock padlock sign in the right upper corner of the screen. Now you are permitted to change the settings. Clinical setting screen. You can change the clinical settings here. In the clinical setting screen, there are 3 settings. Selecting the mode, CPAP, S, T or ST mode. Once you select the CPAP mode, you will be able to select pressure for CPAP. Generally, it will range from 5 to 20 depending on the patient's condition. If you select S, T or ST modes, you will be able to select IPAP and EPAP pressures. All selection is done by pressing the middle knob and value change is done by rotating the knob. How to start ventilation? Once everything is set, press the on-off button on the upper surface to start ventilation. Then you will appreciate the airflow via face mask. Once you press the double lung sign button, then you will see this screen. Here you can see the dynamic pressure indicator on the screen. If the indicator column not rise into set pressure, then you need to check for leaks and oxygen supply. If you want to change the setting during the therapy, press the button with the double tick sign. Then you can change the settings. How to stop ventilation? Press the on-off button on the upper surface. It will stop ventilation temporarily. How to switch off the unit? You need to stop ventilation before switching off the unit. So first press the on-off button on the upper surface and stop the ventilation. Then press the switch on the rear surface. Then a warning message will appear on the main screen and select the yes for permanent switch off. High flow oxygen machine. This is an Airvo 2 high flow oxygen machine. This is the high flow machine available in our hospital. There is no financial interest in doing this video. High flow machine contains the main body, humidifier, oxygen supply, tubing system including nasal cannula. The humidifier is located here in this machine. A sterile water bag should be connected to the humidifier before starting high flow ventilation. This humidifier can control the water level by using the floater inside the humidifier. The oxygen source, a cylinder or wall oxygen, to be connected to the main unit. The blue tube which connect the patient to the system should be connected to the main unit. High flow oxygen delivery needs nasal cannula. Generally it comes in 3 sizes: small, medium and large. The appropriate nasal cannula should be selected according to the patient. The nasal cannula is placed into the patient as follows. Once everything is ready, press the button on the device to switch on. Then the main screen will light up. In this high flow machine, we can adjust 3 parameters. One, temperature. Second one, airflow. The third one is fraction of inspired oxygen, FiO2. First, we set the temperature. For that, we need to keep pressing up and down buttons simultaneously for a few seconds. Then the temperature value will start blinking. Then we can select the temperature using up and down buttons. Here we can select 3 temperatures. Once you select the desired temperature, you can confirm by pressing the forward button. The next setting is the flow. Here also same as before, just press the up and down buttons together for a few seconds. Then the flow value will start blinking. Then adjust flow rate using up and down buttons. Once you get the desired value, confirm it by pressing the forward button. We can adjust the flow from 2 liters per minute to 60 liters per minute. The third parameter we are going to control is the fraction of inspired oxygen, FiO2. This parameter is controlled by adjusting the oxygen supply to the machine. This is done by adjusting the oxygen flow regulator as shown here. Normal air contains 21% of oxygen. By adjusting the oxygen flow, we can supply to the patient up to 100% of oxygen. This high flow ventilation is very uncomfortable to the patient due to it is high flow. Therefore, we need to use this high flow device when it is absolutely necessary. In addition, this device uses lot of oxygen. If you are having an oxygen shortage, this is not a good device to use.